Depression is a complex, multifaceted mental health condition that affects mood, energy, motivation, thoughts, and physical well-being. For many people, therapy, lifestyle changes, and social support play essential roles in healing. But for others, especially when depression is moderate, severe, or persistent, medication becomes a critical part of treatment. Antidepressants help rebalance the brain's chemical systems, reduce symptoms, and stabilize emotions. Understanding how medication works, the types available, and their benefits and limitations helps individuals make informed, confident decisions about their mental health care. To understand why antidepressants are effective, it's important to recognize the role of neurotransmitters, chemical messengers that regulate mood, sleep, motivation, appetite, and emotional responses. People with depression often have imbalances or irregularities in serotonin, dopamine, or norepinephrine. These chemical disruptions contribute to sadness, low energy, sleep problems, difficulty concentrating, and a sense of emotional heaviness. Antidepressants work by adjusting the levels or activity of these neurotransmitters, helping restore balance in the brain. One of the most widely prescribed classes of antidepressants is selective serotonin reuptake inhibitors, SSRIs. SSRIs work by preventing the brain from reabsorbing serotonin too quickly, allowing more of this feel-good chemical to remain active. Higher serotonin levels improve mood, reduce anxiety, and strengthen emotional stability. SSRIs are popular because they generally have fewer side effects compared to older medications. Common SSRIs include fluoxetine, Prozac, sertraline, Zoloft, escitalopram, Lexapro, paroxetine, Paxil, and citalopram, Celexa. They are often the first-line treatment for depression due to their effectiveness and safety. Another important quality is serotonin norepinephrine reuptake inhibitors, SNRIs. These medications increase both serotonin and norepinephrine levels. Norepinephrine plays a significant role in alertness, motivation, and energy. By targeting both neurotransmitters, SNRIs help improve mood, reduce anxiety, and increase physical energy. Common SNRIs include venlafaxine, Effexor, desvenlafaxine, Pristic, and duloxetine, Cymbalta. SNRIs are often recommended for individuals experiencing both emotional and physical symptoms of depression, such as chronic pain or fatigue. Atypical antidepressants are another category that work differently from SSRIs and SNRIs. Bupropion, Wellbutrin, boosts dopamine and norepinephrine, helping increase motivation, energy, and focus. It is often used for depression accompanied by low energy or concentration difficulties. Mirtazapine, Remeron, helps with sleep and appetite and is sometimes used for individuals whose depression includes insomnia or severe weight loss. These medications offer alternative mechanisms for those who don't respond well to SSRIs or SNRIs. Older classes of antidepressants include tricyclic antidepressants, TCAs, and monoamine oxidase inhibitors, SMOIs. TCAs, such as amitriptyline or nortriptyline, are effective but often cause more side effects, such as dry mouth, dizziness, constipation, or weight gain. MAOIs, such as phenelzine, Nardil, can be very effective for certain individuals but require strict dietary restrictions to prevent dangerous interactions. Because of their side effects and dietary limitations, TCAs and MAOIs are usually prescribed only when other medications are not effective. Another treatment option for severe or treatment-resistant depression is ketamine or esketamine, Spravato. Ketamine works rapidly, often within hours, by affecting glutamate, a neurotransmitter involved in learning and memory. This fast-acting treatment can be life-saving for individuals experiencing suicidal thoughts or severe depressive episodes that do not respond to traditional medication. It is administered in clinics under medical supervision due to its potency. Medication is not a magical fix, and it does not change personality or erase emotions. Instead, it creates the chemical stability needed for individuals to function, think clearly, and engage in therapy or daily activities. Many people fear becoming dependent on antidepressants, but these medications are not addictive in the way substances such as alcohol or drugs are. There is no craving or loss of control. However, some medications may cause withdrawal-like symptoms if stopped suddenly, which is why supervised tapering is important. Another common concern is side effects. While antidepressants can cause side effects such as nausea, dry mouth, fatigue, headaches, or sleep changes, these often improve within a few weeks as the body adjusts. Not everyone responds the same way, and sometimes it takes trying more than one medication to find the right fit. This is normal and not a sign of failure. Each person's brain chemistry is unique, and finding the right medication is a personalized process. One key point is that antidepressants take time to work. Most individuals begin noticing improvement within 2 to 4 weeks, but full benefits may take 6 to 8 weeks. During this time, the brain is adjusting to the new chemical balance. For some, mood improves gradually, while for others, energy and motivation return before emotional symptoms improve. Consistency is essential. Stopping medication prematurely can lead to relapse or worsening symptoms. Medication works best when combined with therapy, lifestyle changes, and social support. Antidepressants create the chemical foundation for stability, while therapy helps individuals understand emotional patterns, develop coping skills, and address underlying issues. Together, medication and therapy create a more holistic approach to recovery. Depression medication can be life-changing, especially for individuals who feel stuck, overwhelmed, or unable to function. Many people regain energy, rediscover their interests, and develop a clearer, more stable emotional life. Medication helps break the cycle of hopelessness, making it easier to rebuild routines, restore relationships, and pursue goals. It is important to emphasize that taking medication for depression is not a sign of weakness. It is a sign of courage, a willingness to seek help and take control of your mental health. Depression is not simply sadness. It is a medical condition involving brain chemistry and emotional regulation. Just as someone would take medication for heart disease or diabetes, antidepressants help treat the biological aspects of depression. In conclusion, medication for depression is a valuable and highly effective treatment option for many individuals. Whether through SSRIs, SNRIs, atypical antidepressants, or other specialized treatments, medication helps restore balance to the brain and reduce the emotional burden of depression. It works best when used as part of a comprehensive treatment plan that includes therapy, support, lifestyle improvements, and self-care. Depression is treatable, and medication is one of the powerful tools that can guide individuals toward recovery, stability, and a brighter future.